Doctor, we've talked about diet quite a bit. Why isn't that taught as much in your general medical school? And even when we go to the doctor, why aren't specifics of diet stressed more other than eat better?
Well, it's the same reason that chiropractic isn't taught to doctors, right? I mean, chiropractic medicine is extremely effective. As far as I'm concerned, a good chiropractor is worth their weight in gold. Most people in the United States have, at some point in their life, had a very positive experience with chiropractic, and chiropractic is extremely important. They use acupuncture all over mainland China, and they have for thousands of years. It's extremely effective. It's so effective, they're using acupuncture as anesthesia for major surgeries. Why isn't that taught in medical schools? Why isn't chiropractic taught? Because this is a very important thing to understand, right? Medicine is like a big pizza, and there are different slices of the pizza. The slice of the pie of medicine that the MDs are trained in has no time, no respect, no appreciation, and no concern for anything other than drugs and surgery. Now, there's nothing wrong with drugs and surgery when they're used appropriately. Again, right, thank God for Novocaine and morphine and the sterile technique and penicillin. But MDs are not taught anything other than their piece of the pie because the pharmaceutical industry has leverage over what the MDs are taught. Also, the pharmaceutical industry has leverage over what type of research is done at universities in the United States. It's not medical research that's done. It's pharmaceutical research. Is any research being done about homeopathic medicines or botanical medicines or the use of acupuncture or the use of medical nutrition? No. None of that's being done. It's all about inventing a new drug or a new gene splice or something else. It's all filling in the piece of the pie of science that the MDs are trained in. You know, it's kind of like you wouldn't expect a Republican in the United States to give you advice about a social program, nor would you expect a Democrat to give you advice about war funding, military funding, because it's not really their thing, right? You wouldn't expect a Buddhist to tell you about Judaism, and you wouldn't expect a Roman Catholic to tell you about reincarnation, because it's just not their thing. Well, medical doctors are not trained in medical science. Nobody is. Medical doctors are trained in allopathic reductionism. And allopathic reductionism has no time, no concern, no appreciation for anything other than drugs or surgery. That's the short answer.